Hi guys, Dr. Shilpa Parikh here at Vitality Chiropractic and Wellness. Thank you so much for joining us on our YouTube channel. Today we're here to talk to you about numbness and tingling. We've had quite a few patients come in with bizarre numbness and tingling, sometimes in one hand, sometimes in both hands, sometimes in their feet, and we've been trying to figure out what it's been coming from. Sometimes patients come in and they're panicked, or they don't know if maybe they have some type of a neurological condition or something like that, which could be the case, but we do like to arrive at that conclusion by doing a set of diagnostic tests first and some neurological evaluation and figuring out if it is a musculoskeletal cause. And so the first thing I'd like to say is that if you do have numbness and tingling on the left side of your body and you're under increased amounts of stress and you're concerned about a heart attack, please make sure that you do go and have it checked out. This video is not intended to be a substitute for medical advice. Rather than going down a checklist and God forbid something terrible happening, I recommend that if you're concerned that you may be having a heart attack, that you go and have that checked out. So with that, let's get started. Numbness and tingling, the most common causes we see here in practice. The first one is definitely going to be some tight trigger points. People come in with really tight shoulders, wrists, forearms, and they're getting decreased circulation into their fingers and into their arms, and they're concerned that they might be having carpal tunnel or some type of a syndrome or some type of an advanced health condition. That's not always the case. If your muscles are in a state of contraction for a certain period of time, or they're just not getting the right amount of movement, that will decrease the blood flow into that area and cause overall decreased circulation. And so you could be getting numbness and tingling from that. Another cause of numbness and tingling could be disc compromise. So in between your individual vertebrae, you have little cushions, and those cushions are meant to absorb shock and to kind of help buffer the impact to your individual vertebrae. And so sometimes if those discs get squished, or if they start to be pushed out a little bit, you can start to have some compromise of nerve firing, and of course then decrease circulation and start to get some numbness and tingling either down your legs, which sometimes people will come in asking if maybe they have sciatica, or sometimes they'll have numbness and tingling in their pinky or in their ring finger. So just certain things can trigger us to consider maybe it might be a disc. We might ask for an x-ray or an MRI. Of course, a plain film x-ray doesn't show a disc. You need an MRI to diagnose a disc lesion, but an x-ray will show if vertebrae have moved closer together or farther apart, and so that's something that we want to use to evaluate the integrity of your spine. Another cause of numbness and tingling could be rheumatoid arthritis. You may want to check in with your family. Just think about your family history, ask around uncles, aunts, brothers, sisters, see if there is any rheumatoid arthritis in the family. The other thing to consider is hypothyroidism. My postpartum mama is talking to you. Hypothyroidism is pretty common after having a baby. Sometimes it can resolve on its own. Sometimes you have to take medication for a while. Sometimes you can make some dietary changes and take certain vitamins to help balance out your thyroid. So it kind of depends on the person. So make sure that you do consider that. Another thing to think about could be diabetes. Sometimes one of the earliest symptoms of diabetes could be numbness and tingling, decreased circulation. You might notice visual changes, headaches. That's another common thing too. You can watch one of our headache videos if you're interested in more about that. But another thing too could be side effects from medications. If you're taking certain medications, you might have numbness and tingling as a consequence of that. So make sure that you're having your dosages monitored and checked pretty regularly. Apart from that, there are so many different reasons why you could be having numbness and tingling. Please don't Google and jump to the worst case scenario. We see that happen all the time, and we really want to reassure you that if it is something that is terrible or something that's really bad, your inner voice will let you know, and you will probably go seek out the medical care that you need. So please leave us a comment if you have any comments or questions for us. Thank you so much for joining us on our YouTube channel. We hope that you stay happy, stay healthy, stay safe. Thank you.